Wastewater sources refer to the various origins of water that has been contaminated through human or industrial activities. Treatment goals in wastewater treatment are aimed at reducing pollutants to safe levels before the water is released back into the environment or reused. The primary goals include removing harmful pathogens, reducing chemical contaminants, and minimizing the environmental impact on aquatic ecosystems. Treatment methods are the processes used to treat and purify wastewater to meet environmental standards. These methods typically include physical, chemical, and biological treatments. Physical methods, such as screening and sedimentation, remove large particles, while chemical treatments may involve adding substances to neutralize pollutants. Biological treatments use microorganisms to break down organic matter. Preventing disease transmission is one of the primary reasons for promoting proper hygiene practices. Good hygiene, such as regular hand washing with soap. Protecting workers is another key benefit of proper hygiene practices, particularly in industries where workers are exposed to hazardous materials or infectious agents. Maintaining water quality is closely linked to proper hygiene practices, particularly in areas where water is used for consumption, agriculture, or industrial purposes. Bacteria are one of the most common pathogenic microorganisms found in wastewater, often originating from human waste, food waste, and industrial discharges. These bacteria can cause a range of diseases, including cholera, typhoid fever, and gastrointestinal infections. When wastewater is not properly treated, harmful bacteria can contaminate water sources, posing significant risks to public health. Viruses in wastewater are another major concern, as they can be transmitted through contaminated water and lead to viral infections like hepatitis A, rotavirus, and norovirus. Parasites are also present in wastewater and can include protozoa, helminths, and other parasitic organisms. These parasites can cause a range of diseases such as giardiasis, amoebiasis, and schistosomiasis. They often enter wastewater through human and animal waste, and their eggs or cysts can survive in untreated or inadequately treated water. Ingestion is one of the primary transmission routes for waterborne diseases, occurring when contaminated water is consumed directly or through the ingestion of food that has been in contact with polluted water, leading to diseases such as cholera, dysentery, and typhoid fever. Contact with contaminated water is another common transmission route for waterborne diseases, especially when individuals come into direct physical contact with polluted water during activities like swimming, washing, or bathing. Pathogens can enter the body through cuts, mucous membranes, or through the mouth if water is ingested accidentally. Inhalation of aerosolized water droplets is an often overlooked route of transmission for waterborne diseases, particularly in areas with poor water quality. When water sources, such as lakes, rivers, or improperly treated wastewater, are disturbed by human activities or environmental factors, pathogens can be released into the air as fine droplets or mist. Gloves are essential personal protective equipment, PPE, for wastewater workers, as they protect the hands from direct contact with harmful pathogens, chemicals, and sharp objects that may be present in wastewater. Boots are another critical part of PPE for wastewater workers, providing protection for the feet from exposure to contaminated water, chemicals, and debris. Respirator masks are crucial PPE for wastewater workers who may be exposed to hazardous airborne contaminants, such as methane, hydrogen sulfide, or aerosolized pathogens. Respirator masks, designed to filter out harmful substances, help ensure that workers are protected from inhaling toxic gases or particles present in the air. Hand washing and sanitization protocols are critical for preventing the spread of infectious diseases, especially in environments where exposure to contaminants is common. The protocols typically involve thoroughly washing hands with soap and clean water for at least 20 seconds, ensuring that all surfaces, including between the fingers and under the nails, are cleaned. Water quality testing is a crucial aspect of wastewater monitoring for public health, as it involves assessing the physical, chemical, and microbiological properties of water to detect contaminants that could pose health risks. Public health surveillance in the context of wastewater monitoring involves tracking patterns of waterborne diseases and outbreaks that may be linked to wastewater contamination. By analyzing trends in disease occurrence and correlating them with water quality data, public health authorities can identify potential risks and take preventive measures. Risk assessment and management in wastewater monitoring involves evaluating the potential health risks associated with wastewater contamination and determining the necessary actions to mitigate those risks. This process includes identifying vulnerable populations, such as children or immunocompromised individuals, who may be more susceptible to waterborne diseases. Pharmaceuticals in wastewater are emerging contaminants that pose significant challenges to wastewater treatment systems. These substances, which include antibiotics, hormones, and painkillers, enter the wastewater system through human excretion, improper disposal, or pharmaceutical manufacturing discharges. Microplastics are small plastic particles that are increasingly found in wastewater, stemming from the breakdown of larger plastic items, synthetic fabrics, and personal care products. Per- and polyfluoroalkyl substances, PFAS, are a group of synthetic chemicals that are highly persistent in the environment, earning them the nickname forever chemicals. PFAS are used in a wide range of products, such as non-stick cookware, water-repellent fabrics, and firefighting foam, and can enter wastewater through industrial discharge or consumer use. Hygiene is key in preventing the spread of waterborne diseases and maintaining public health. Proper hygiene practices, such as regular hand washing with soap and water, are fundamental in reducing the transmission of harmful pathogens, particularly in environments exposed to wastewater. Promoting hygiene not only protects individuals from infections but also ensures cleaner communities and safer water sources. PPE protection is essential for safeguarding workers who handle wastewater, as it helps prevent exposure to hazardous pathogens, chemicals, and debris. The use of personal protective equipment such as gloves, boots, and respirators minimizes the risk of infection or injury, ensuring workers' health and safety while maintaining effective wastewater management. Monitoring is vital for ensuring effective wastewater management and safeguarding public health. Regular monitoring of wastewater systems, including water quality testing, pathogen surveillance, and pollutant levels, is crucial to detect contamination early and implement appropriate interventions.